Hi, these are my responses for Module 8. The first prompt asks, Gingler outlines some clear advantages that assisted the two families described in the article. Discuss these advantages. What are some of the fundamental causes of inequalities discussed in the article? Have you or someone you know had to navigate our healthcare system? I think some of the clear advantages assisting these families are that they are more properly cared for, given better medicine, and even given better treatment that other patients would not have gotten without directly asking. I feel like this is because they have more resources, networks, and money. Upper class people get higher care and levels of treatment when we are all human and all of our lives are equally valuable. I know this is a big problem and it is awful that someone's life is handled differently based on these social factors that some people cannot even help. Gingler discusses fundamental causes of inequalities by sharing stories of different class families and the treatment their children received or were able to get at all, as well as showing how having money, network, and medical knowledge plays a huge role in the treatment and care that is provided to someone. By sharing these stories, it opens readers' eyes to how much this inequality really does affect so many lives. My stepsister had been in and out of the hospital many times a few years ago. On multiple occasions, my stepmom would have to intervene and ask the doctors to fix something or stop doing something they were doing. One time in specific, they were giving her a medicine and it started making her have seizures. Since my stepmom knew of this medicine and that happening with it, she was able to speak up and tell them to stop giving it to her. Once they finally listened and stopped, so did the seizures. Not everyone has the knowledge to speak up in these situations, and it's sad that it has to be that way for people to get the proper treatment sometimes. For prompt 2, it asks, what are some of the solutions discussed by Vincent? What changes would you like to see happen? COVID-19 certainly disrupted society in many ways, but most notably in our healthcare system. How did you see our system respond? I said I think changes I would like to see happen are more people continuing to educate themselves so that we can protect ourselves from unequal treatment. I feel that as much as we should not have to do anything to stop this from happening, we have to. Another change is overall just speaking up as a whole and truly wanting this inequality to end. I know that if people of all social classes came together, this situation could get more light shed on it. Vincent discusses solutions like the collaborative learning health system. This system uses real data from patients to improve the quality of care. While stating all the positive changes this can bring for the world of healthcare, the negatives are still discussed. By bringing up the point that while this can help in many ways, this learning system can be constrained / bring up limitations by the organizational processes of our healthcare system today. I saw our healthcare system respond to COVID because my mom was a nurse during this time. She would tell us how insane work was and she was constantly exhausted. She began working even more hours as COVID progressed while being concerned about the health of her and her family constantly. I slowly saw it become something she could no longer do to herself. Since she left that job a little while after COVID, she became an at-home nurse. The hours are much better and overall a much less stressful job while getting to be with family. This correlates perfectly with the article talking about healthcare workers getting burned out and how it brings up the transition to telemedicine care. Thank you, and that's all I have.